Recently, we've had one of the candidates for governor, Christie, come out with an idea that would say that insurance companies shouldn't have to pay for certain kinds of treatments. Basically, his idea, along with the Bush administration line, is that let's deregulate the insurance companies, let them make decisions about what they shouldn't pay for or what they should pay for, not necessarily you or your doctor, but allow insurance companies basically free rein to cover what they want, drop you from insurance as they wish, based not on what's good for your health, but based on what's good for their bottom line.
When my son was a year old, I knew something wasn't right. At 3 years old, we were told not to expect our son to be able to speak. My health insurance would not cover his speech. When we got his official diagnosis of autism, our insurance wouldn't cover ABA, which is Applied Behavior Analysis Therapy, which is one of the most effective treatments for children with autism. You know, I did not have the tools or the resources that the trained therapist had, but I did know that there was a limited window of opportunity for me to affect my son's development. Even though we had health insurance that we paid for, I had to spend my own money. I had to borrow money from relatives, and I had to use my credit cards and mortgage my house to get my son to the point where at 4 years old, he could finally say the words that every mother wants to hear, Mommy. We now have an 8-year-old son who has been mainstreamed in our public school and has the same opportunities that his peers have. And if you ask him what he wants to be when he grows up, he can now tell you himself. That's why this mandate is important.
It's critical to families. Every parent wants to see their child, I don't care what challenges they're born with, to do as well as they can to be successful in this world. And the question for all of us is, should we as a society help families who face this to move forward and to take care of the health and to help children be successful and to do well? Or should we have a policy that says, let's walk away from these families and leave families to deal with these important problems on their own? We've said to families, we as a society, we're going to reach out our hands, we're going to help you. We're going to help you help that child do as well as they can. And that's the kind of policy I hope you'll stand up for. That's the kind of policy our governor stood for, and I'm proud to have helped him with others, many others, to achieve that.
I am a 15-year, 4-time breast cancer survivor. Back in 1995, it wasn't even, insurance companies were not covering mammograms for women under 50 because the guidelines at that time said women under 50, there's no test that's accurate for you. We'll do 50 and older. And I had to fight to just get a baseline mammogram. But the mammogram that was a baseline was the mammogram that found my cancer. But I would not be here if it was not for that original mammogram. Why would you cut the one test that saves women's lives?
It's sad to see a candidate for governor seriously propose that we roll back these protections. You've heard so many of the great stories and the empowering stories here today of how these mandates really affect us in a day-to-day life. Breast cancer is real and it affects women. Autism isn't something that you can chicken soup away. And we think that all of the hard work that we've done to create these mandates really needs to continue.
His mandate-free policy would remove from women an important protection to make sure they can get preventative cancer care when they needed it, according to their history, their background, and in consultation with their physicians. That's the way we want to do it, not this sort of Bush administration, Christie Republican way, which says, well, we're just not paying for it. People want to be healthy, and they want their children to be healthy, and they want their family to be healthy. And policies count. They matter. This election matters. And I hope you'll agree with me that we should stand behind, stand with Governor Corzine as he stands up to insurance companies to say, you are going to provide a basic set of services to people here in New Jersey because people here in New Jersey deserve it.